Ever since I was a little kid, I was suffering from seasonal allergies. And as I got older, the allergies turned into asthma. Somebody told me about NAET treatments, so I figured it was worth giving it a look. After the first couple of treatments, I started feeling better. And little by little, after each treatment, it just was getting better and better and better. And here I am today, allergy-free.
So I was watching TV and I was laid off from work, and I happened to be home during the day, and I saw a segment on NAET, and I realized that the child they were speaking of, my son had a lot of the similar characteristics, and they were saying that NAET helped him, and he was going to school and he was perfectly on par for kindergarten. And at that point, Tyler didn't speak. He was 2 years old, and we had our suspicions of autism. So I looked up an NAET practitioner in the area, and I brought Tyler to her, and it was very successful.
When you think about the NAET therapy, everybody always thinks, oh, it must be voodoo, it must be something strange, this is so unusual, it's non-invasive, it's no medicine. What is it, and what is it doing to my body, or what is it actually doing? Because you can't really see it, you can only feel it. So my husband finally agreed to it because he was in so much pain, and after like 2 or 3 treatments, the pain went away, and he treated it, and it never has returned. So he went from taking a lot of cortisone shots to being free of gout.
NAET is a revolutionary treatment that successfully treats allergies or imbalances in the body. It functions by combining the principles of acupuncture, chiropractic, kinesiology, and nutrition. This healing technique was founded by Dr. Devi Nambootripad in 1983. A medical doctor who also holds a degree in chiropractic and a PhD in acupuncture. NAET treats allergies or imbalances, whether they stem from food, chemicals, the environment, emotions, and even nutrients. An allergy is a condition of unusual sensitivity of a person to one or more substances, which may be harmless to the majority of other individuals. During an allergic response, the allergic substance or allergen is viewed as a threat to the body's well-being, thereby eliciting an allergic reaction. According to the principles of Chinese medicine, contact with an allergen causes blockages in the energy pathways called meridians, thus disrupting the flow of energy through the body's electrical circuits. This blockage causes interference in communication between the brain and body through the nervous system, resulting in a chain reaction which ultimately produces an allergic response. Allergies manifest in a multitude of ways. Allergic symptoms range anywhere from anaphylaxis, the deadliest form, to headaches, hives, rashes, breathing difficulty, diarrhea, constipation, gas and bloating, pain, fatigue, and emotional imbalance, to name a few. The same allergens can produce different symptoms in different individuals. For instance, one individual may consume wheat products, causing a rash, while in another individual, it causes asthma, and in another, gas and bloating. Allergies may be categorized into 2 groups: true allergies, which are mediated by IgE antibodies, and intolerances or sensitivities, which are mediated by IgG antibodies. A true allergy produces a histamine reaction, resulting in symptoms such as redness, swelling, hives, itching, watery eyes, runny nose, difficulty breathing, or anaphylaxis. A sensitivity or intolerance may produce symptoms such as gastric distress, headaches, muscle or joint pain, behaviors such as hyperactivity, anger, depression, and anxiety, as well as eczema, acne, sensory issues, insomnia, bloating, gas, diarrhea, constipation, or hormonal imbalance. A simple food allergy blood test to evaluate the severity of these allergies, IgE and IgG, would be highly recommended if your symptoms are related to food allergies. Your practitioner can send you for this test, which will help to determine how many treatments may be required to successfully alleviate the allergies. A mild allergen will require fewer treatments than a severe allergen. With NAET, even the most severe allergies, anaphylactic allergies, can be successfully treated. Blood work taken pre- and post-NAET treatments validate the effectiveness of the treatments by exhibiting a reduction in the level of allergen post-treatment. Reductions in other blood values, such as hormonal or sugar levels, have also been demonstrated on patients treated with this technique. The NAET treatments remove the allergic blockages, producing an allergic response. By stimulating pressure points along the spine from the neck to the sacrum, these points activate the spinal nerve roots and meridian pathways alongside the spine. Stimulating the nerve roots while in contact with the allergen, in turn, activates the nervous system. And by activating the nervous system with the presence of the allergen on the body, the nervous system and immune system are enabled to reboot or reprogram its reaction to the allergen. As a result, the alleviation of the allergic symptoms caused by the treated allergen is achieved. The body no longer perceives that item as a threat and no longer elicits an inappropriate allergic response. Specific acupressure points, called the gate points, are then massaged or needled before the placement of the allergen against the skin for 20 minutes to stabilize the treatment. The allergen must be avoided for 25 hours after treatment to allow the body to process the changes. The practitioner can provide you with the specific dietary avoidance necessary for each treatment. You can also purchase the NAET guidebook, which furnishes all the dietary avoidances for each basic allergen being treated. This guidebook contains pertinent information regarding the treatments, including instructions for all new patients, which is a required reading to inform patients of proper protocol and functions that may affect the treatments. Important information such as eating and drinking before treatment and shutting off electronic devices during treatment is listed in the instructions. A patient may experience a healing reaction or detoxification effects from the allergen as it is being cleared from the body. Thus, the symptoms produced by the allergen may manifest and become exacerbated during the detoxification process, even though the allergen is being avoided. Therefore, patients must be aware that their symptoms may heighten before they cease. Once an allergen is fully cleared from the body, the symptoms caused by the allergen will cease. It may take only one treatment to clear a mild allergy, but it may take multiple treatments to clear the severe ones. If multiple treatments are required, the patient will be instructed by the practitioner on how to continue the treatments at home to expedite the treatment process. Once an allergy is treated, there are 3 methods to determine if the allergy is fully cleared from the body. The first is by reintroducing the allergen to the body, either by orally challenging it in the case of food or by the exposure if environmental. This method can only be administered for allergies that are not anaphylactic or life-threatening. If no symptoms arise during reintroduction, then most likely the body cleared the allergen. The second method is by retesting through blood work to reassess the change in blood values. Any allergy level testing 0 is definitive proof that the allergen has been fully cleared. If levels have not declined completely, then more treatments will be required. Interestingly enough, blood levels of an allergen may rise before declining as the body is detoxifying itself of that allergen. In like manner, the symptoms of the allergen may rise before regressing. The third method of test for allergens is through kinesiology. In addition to testing allergies, the NAET practitioner will use a technique called kinesiology, or NST. To determine allergic weakness in the body, kinesiology, or NST, locates energetic blockages in the body that are responsible for allergic reactions. The Naet treatment acts to remove these blockages. According to the Naet website, kinesiology is used in Naet to compare the strength and weaknesses of any muscle in the body, in the presence and absence of any substance. A measured weakness in the presence of a substance is due to the effect of an allergy to the item the person is touching. This simple method can be used to detect your allergens. In other words, the allergic blockages created by the allergen causes physical weakness in the body, which can be measured through simple muscle testing, dynamometer testing, or even differences in pulse or blood pressure readings. A trained kinesiologist will be able to detect the measured difference in energy. A strong kinesiology or NST test post-NAET treatment will indicate that the allergen is no longer creating energetic blockages in the body. A study conducted at Oxford University and published in Complementary and Alternative Medicine in 2016 concluded that muscle response testing, or kinesiology, demonstrated significant accuracy for distinguishing lies from truth compared to both intuition and chance. It was deemed as accurate as manual blood pressure readings. Illness usually occurs as a result of four major issues: nutritional deficiency, overtoxicity, emotions, and genetics. Nutritional deficiency, the most important cause of chronic illness, may be the result of malabsorption of nutrients in the body. NAET practitioners refer to this as an allergy to the nutrient. Allergies to vitamins and minerals will result in either lack of proper absorption or the lack of proper utilization of that nutrient in the body. The resultant nutrient deficiency will lead to a dysfunction in the nutrient's ability to perform its many tasks. For example, an allergy to vitamin C will result in a dysfunction of the immune system, since vitamin C plays a vital role in the functions of the immune system. Likewise, an allergy to calcium may lead to bone loss or blood pressure issues. Dr. Nambutrapad created a protocol to address the nutritional deficiencies caused by blockages of nutrients in the body. All NAET practitioners will test and treat for this basic 15 items first. The basic 15 is comprised of nutrients as well as some foods, digestive factors, and hormones. They are items that are essential for the body's functions and, when treated, create a proper foundation of health. Since the nutrients involved in the basic 15 are all essential for major bodily functions, the ensurance of their proper absorption is necessary for those functions to occur. The vital systems of the body, including the immune system, circulatory system, digestive system, nervous system, and so forth, will all directly benefit from the proper utilization of these essential elements. Therefore, any health condition will be addressed by treating for the basic 15 first, because it resets the foundation of one's health by rebalancing a person's immunity and vital systems. This allows the body to be able to heal itself. After completing the basic 15 and strengthening the immune system, one may be treated for additional allergens, such as food allergies, environmental allergies, hormonal imbalance, or whatever else is needed. Stronger allergies require a fortified immune system to ensure successful treatment and outcomes. Therefore, it is vital to strengthen the immune system first with the basic 15 before embarking on treatments for other allergies. However, emotions can be addressed after completing the first 6 basic items. Emotional treatments allow a patient to handle an emotion without the damaging effects that emotion may pose on the body. In 2005, Dr. Nambuchapad and Dr. Jacob Teitelbaum conducted the first prospective and controlled study on NAET and autism. This study was published in the 2011 issue of Integrative Health. A clinician's journal in 2011 portrayed the treatment of 60 children with autism, 30 with NAET and 30 with placebos. The treatment group received NAET treatments for 50 key allergens for 1 year, while the non-blinded group did not receive any NAET treatments. After the year of treatments, the child receiving NAET treatments demonstrated significant improvement in performance compared to the control group, as determined by standard autism score systems. 23 of 30 treated children were able to attend regular school classes with typical peers, while 30 of the 30 children in the control group continued to require special education. This study successfully proved the effectiveness of NAET treatments in decreasing the severity and symptomology of autism. Many patients have reported attaining relief from many other medical conditions with NAET. This is simply because so many health conditions are allergy-based. NAET treatments simply help patients overcome their ailments in a safe, effective, and non-invasive manner by eliminating the cause of the condition. Rather than just masking symptoms with medication, find relief from your health issues today with NAET.